So, if stretching worked the way most people think it does, we would be done by now, right? Your neck is stiff and sore, you stretch it. You feel like you're tight when you bend forward, you stretch your hamstrings. You roll your shoulders constantly after a day's work, but the tightness keeps coming back. So, what if the problem isn't that you haven't stretched enough? What if the thing you're feeling and calling tight muscles actually isn't muscle at its root cause? So today I want to introduce something that changes the whole way we understand pain, posture, what tension is, and how we recover from it. And it's fascia. And if you've heard of fascia in the world out there, we kind of think of it like Saran wrap that's wrapped around your muscles, but it's not inert. It's dynamic. It's a living network. And once you begin to understand that and really feel what that means, you'll start to see that fascia is not just shaping how you move, it's shaping how you adapt to change, how you heal, how you carry stress. And even in your cells, it helps you respond to the life that you're living. I'm Dr. Melanie Carlone, a somatic physical therapist, yoga instructor, and a lifelong student of how the nervous system and the body organize around stress and safety and healing. Welcome back to the Fascia Frontier Series. So in this episode, I want to talk more deeply about fascia, that connective tissue web that links every part of the body together. And more importantly, I want to explore why the body feels stuck, even when nothing seems injured, and what you can do about it. Because often the body isn't stuck, it's protecting you. And when we understand that, when we actually bring compassion to this body that sometimes we just don't understand, we begin restoring flow instead of fighting tightness. We soften before we can actually strive. And that matters because so many people today are living in bodies that feel dense and inflamed and compressed, and we're always bracing, we're exhausted. And we've been told to stretch harder, sit up, strengthen more, push through it. But healing is not mechanical. I mean, there's a part of it that's mechanical, but it's actually regulatory. It's in how your body regulates what's going on, and you can make a difference with that. Because when your body feels safe, it actually can change. So let's start with the basics. Most people think fascia is like plastic wrap around the muscles, but it's really not accurate. Fascia is more like this three-dimensional tension network, and it connects everything in the body. It wraps around your muscles. From the muscles, it goes into the muscle bundles. From that, it goes into the fascicles. From that, it goes all the way down into the cells. It goes around your organs, does the same thing. Every nerve, your blood vessels, your lymphatic system, your bones. It creates continuity from your head to your toe. You literally could travel from the top of your head all the way to your big toe. It connects you from the inside to the outside, from the outer surface all the way to the depth, all through this fascia web. And it links one area to another, so movement and force in the fascia travels through the whole system. Like, think about a spider web. If you pull one corner of a spider web very gently, the whole web responds. It's the same way with you. Your body's the same way. So that's why a sprained ankle can eventually affect your back, or why tension in the jaw actually influences the pelvic floor. That's why the place that hurt is not always the place where the story began. And that's one reason why it keeps coming back and why people get confused. Because conventional thinking looks at us as pieces and parts. It says, where's the pain? And then it tries to treat there, but then the pain comes back. Fascia invites us to consider a very different question. How is my whole system organized around the load I'm placing on it? That is a really different lens, because the body's like this interconnected, whole dynamic symphony, and symptoms are rarely isolated. They're in relationship to each other. So if the body is this interconnected, why does pain show up just in one place instead of just everywhere? So that's something to think about. Pain shows up in specific places where the system has reached its limit. Now remember, fascia distributes load across the body, But when one region can't compensate anymore, that's where the signal appears. That's where the brightest spark of, oh my God, I'm failing. Think of a fishing net hanging from the ceiling. If you grab a corner of it and pull in one direction, very slowly, maybe subtly, you're going to see change in every part of that net. And eventually, one section bears the most tension. And that's where the strain appears. That's where the breakdown is happening faster than the buildup, because your body's always in this dynamic relationship with breaking down and building up. And you want to be ahead of the curve by building up. So this happens when you sit for hours, you collapse forward at the computer, you're holding your breath, you're clenching your jaw, you're bracing your belly. We're in a world of near constant stress response. But when you bring your attention and your compassion, you begin to change that. Because the body organizes around loads you place on it. And we have far more choice over that than we think we do. When the load is not conscious, over time it starts to feel normal. You may not even realize how much effort your system's using just to hold itself together. And that's where I want to just slow it down. Because many people listening to this have been told their symptoms are random. You have to get imaging, it doesn't show anything, but you know you're feeling it, or that it's all in your head, you just need to loosen up. But what's happening in your body is extremely intelligent. Your body's distributing stress the best it can until one place says, I can't carry this anymore alone. Isolation's the root of so much of our pain. So when your neck hurts, or the low back is grabbing, or your hips are stiffening up, or your ribs feel tight, or your jaw just won't let go, the question is, why is that pattern sticking around even after I'm working on it, I'm stretching it, or trying to fix it? This is where the beauty comes in. Because fascia doesn't tighten randomly. It responds to load, and load isn't just mechanical. It's also emotional stress. It's your sleep that's been disrupted, inflammation, chronically vigilant, brain's racing all the time, you're holding your breath, you're overworking. Old injuries, protective habits start to show themselves, and a nervous system that hasn't felt safe enough to come out of the guarding, what scientists called allostatic load, begins to happen. And that cumulative, that built-up burden of stress across the body starts to reveal itself. And if we don't intervene, if we don't bring in elements to increase the healing, and the load stays high, the fascia stiffens to stabilize the system. Your muscle tone increases. Your breath is shallow. You're breathing up here. Your posture's adapting to all of this. It's trying to protect you. The green light reflex, where the back of the body's stiff. The red light reflex, where you're collapsing. A combination of them. That's how the body's only ever trying to help. Give it thanks. Give it a break. Because what feels like tightness in your body may actually, and often is, a protector pattern. It is a brilliant strategy the body uses to stay stable and hold. It's trying to hold it all together. It's not a defect. It's not a failure. It's not proof that you're broken. It may simply be your nervous system saying to you, I don't trust that it's safe to let go. And that is a really critical reframe. Because if you treat protection like a problem, the body often protects more. You're just not listening to it. You don't get it. But if you can enter in and recognize protection is intelligent, it's doing the best that it can with the resources it has, you start a very different conversation. A conversation that's based on you listening to yourself, that's based on pacing, usually slowing down. It's based on regulation of the nervous system itself. And that's where fascia gets even more fascinating. Because it isn't just around the body, it's part of the body's communication environment. So it is an extracellular matrix. It's like this webby element that flows, connects the entire body, the environment outside of the cell. But it's even mechanically and biochemically linked to the inside of the cell. This is where it gets fascinating. It's connected through the cell membrane, through structures called integrins, these little adhesions, and the cytoskeleton itself, like the structure of the cell. So integrins span the membrane of the cell, and they connect outside to the inside of the very cell. So forces in the matrix of your body influence cell shape. They influence how the cell signals. They can even affect how your genes express. So just pause there for a moment. That means the tone in your connective tissue environment really matters. It matters to the very future you're creating for yourself in your body. That pull and pressure and compression, hydration that you have, inflammation circulating the body, the stress are all carried in that matrix. And they're not just happening out here in some passive wrapping. They're part of the conversation your cells are actually receiving to know what to do. So it means fascia is not just influencing your movement, it also is influencing cellular behavior. It's participating in the unfolding of how your body adapts over time. Not in a magical way, not in fear, but in a living, responsive, biological way. And you're knowing it and entering in, and compassion's really important. Starts to change the whole picture. So when we talk about sleep and breath and movement, we talk about inflammation and stress, hydration, nutrition, rest, connection with other people, nervous system safety. These are not separate things. We're talking about the very conditions that change the shape of the terrain, the environment your cells live in. And that's one reason healing can't be reduced to one stretch or one exercise or one correction, or certainly not to a pill, because the future of the body's being shaped by the environment your body's practicing every day. So if fascia tightens to protect you, how do you help it feel safe enough to soften? That's the question. All right, here's the key to the kingdom. One of the biggest mistakes people make is forcing stretch in the direction that feels restricted. So you pull. So I have old injury. I can't rotate very far to the left. And so if I'm thinking, well, I can't go to the left, let me just stretch it and move it to the left. But when I do that, the muscles that are holding get the message it's not safe. It's guarding, and it reinforces that protection. Because the nervous system may interpret that force of going into that injured area, that old injury, as a threat, and threat increases muscle tone. So instead of gaining freedom by forcing into the tension, you get rebound tightness. And after that, you can get soreness. Sometimes after a massage, have you ever noticed you get stretched out and then you're really sore? If you think you need to work harder, think again. Because the body doesn't actually need more force. What if it needs a more skillful invitation? So instead, let's start with something simpler. Let's move in the direction of ease. Because when the body experiences safe movement first, the nervous system starts to trust, oh, you're present. You see me, and it can release. And it's not laziness or avoidance. It's not giving in to the dysfunction. It's using the doorway. The body can actually know that you're hearing it. It can walk through that doorway. It's willing, and that willingness matters. Because a body that feels coerced or forced will brace. I mean, look at how we are in our own lives. Our bodies are the same thing. But a body that feels seen and met has a chance to reorganize. So let's try something together. Let's do a listening conversation with your nervous system. And of course, you can stop anytime. Just keep it small and keep it easy. And let your curiosity lead. So let's do a micro test with the neck. Slowly turn your head to the right. And just notice how it feels. As far as you can go without pain. And then turn the opposite direction. And just notice, go back and forth. Is it smooth? Is it sticky? You probably can see I go a lot further to the right, 10 to the left. It's tight, effortful. Now, come back to the center and just notice which direction was a little easier. Sometimes it's not dramatic, it's just like a small 5%, but it's definitely easier, all right? That's your direction of ease. Now check this out. Gently turn towards the easier side, maybe 50% of your effort, maybe less, right? And move slowly. And I'm letting my eyes lead, so my vagus system, my vagal nerve is in down regulation. And I go easier to the right, and I come back. And I'm breathing in the low back. Long, slow exhale through the nose. Back in the direction of ease. 50% of effort, eyes to the side, come back. Okay, and we're going to do that 5 times. Keep the motion small and very comfortable. You don't need to force this. Coming back, let your jaw soften. Let your eyes lead. And then long, slow exhale, come back. All right, so I went 5 slow times to that side. Everything was easy. Breathe into my low back, my eyes going, no forcing. Not trying to make something happen. Now, feel your feet, feel your body. Now recheck the side that felt restricted. Holy moly! Did it change? Sometimes it's just a little, sometimes it's a lot. I mean, can you see that? The change is not forcing the range. It's actually less effort. It's less bracing. It's less threat. And that counts because the body's learning something new. So this is how we start to work with fascia as a living network, not a stubborn, fixed enemy. Fascia and the nervous system respond best to small inputs, repeated over and over again. That builds new habits. So my tendency from old injury is to have my head to the right. And I even have bone spurs that can go down nerve pain in my arm. The doctor said in 2017 I needed surgery. Not gonna do it. Set me in part on this journey. And now I have no pain down into my hand. And if it starts coming on, I know I'm going into my old pattern and that bone spur may be forcing it. But when I dose the change, when I let my body keep learning through experience every time it needs to, that it's safe, not by being overpowered, but by moving in the direction of ease, I'm recruiting the protector. It's holding me over to the right. Well, let me go left. I'm recruiting that protector and letting it know, I see you. I'm not fighting you. I feel you. I'm not going to override you. Let's work together to find a way. And that compassionate input changes the whole quality of the conversation. And over time, that matters. And these are all small signals. Your breath, your hydration, your sleep, inflammation, how you perceive pacing, how you are in your relationships with safety, moments of orienting and softening the nervous system, moments of completing and letting go. That's where the body realizes, I don't have to hold so much. It's not in isolation. It's working with you. And that's how the network reorganizes, not all at once, but gradually. So when you can understand that fascia is part of the whole matrix of the body, when you reduce the allostatic load, that pressure of stress across the whole body, and that fascia can work with the chemistry and communication with your very cells, these little small inputs add up and they become very meaningful. Because every time you reduce unnecessary tension and bracing, every time you improve your breath mechanics, every time you hydrate well, you have the minerals and salts you need, every time you lower the inflammatory burden because you're choosing whole foods, you're eating things that your body absorbs well, every time you bring yourself out of a chronic vigilance where the body feels under threat, You change the environment your tissues are living in. You change your terrain. You affect the context in which healing happens, where buildup is faster than breakdown. You're actually aging in reverse. And you help shape a more coherent future, how things are likely to be from the inside out. And it doesn't mean perfection. It doesn't mean control. And it certainly doesn't mean blame or beating yourself up. It means possibility and gratitude. Because your body's not fixed in stone. It's constantly adapting. And that leads to the most important realization, I think, is that your body's not broken. It's doing the best it can. So give it some love. So if you notice as you listen to this, maybe there's a softening in the jaw, you have a little more motion in your neck, your breath is a little deeper, maybe just a new dawn of understanding why your body has been holding and those old pains keep coming back, I would love to hear what you notice. Share it in the comments. If this way of understanding how the body speaks to you, subscribe so you can follow the rest of this Frontier series. And I want to name one more important piece here. When people hear that fascia may influence your cell signaling or your gene expression, sometimes that feels scary, right? So let me be clear. This is not around fear at all. I hope that you can feel a sense of reverence for how responsive your body is. Your genes are not a fixed destiny sentence. Your genes are constantly changing and adapting. Yes, you have predispositions, but you can make a difference. And that fascia is not a prison. What that all tells us is really hopeful. Your body's listening. It's listening to the mechanical load. It's listening to the biochemical expression of your emotions, to inflammatory chemistry, to your breath, to the pacing and the rest you give it, to the hydration, the nourishment, how you move. It's listening to the environments you choose to live in, inside you and outside you. And because it's listening, what you practice matters. And if you don't approach it as a perfectionism, but you are gentle and very compassionate, the daily conditions of just caring for yourself can help shape the very terrain that your future healing unfolds in. So that's why I care so much about these small, repeatable, body-safe practices, because they're not small to the nervous system. They're not small to living tissue. A little less bracing matters. A little more breath makes a difference. Less inflammation is a game changer. A little more safety overall lets the protector relax. And over time, those little things become a very different story inside your body. So the next time you feel something tight, just pause before your stretch and ask yourself, is my body stuck or is it protecting? And maybe even ask, what kind of environment am I continuously creating in this body? Am I hearing it? Am I trying to add more force? Or am I creating conditions for flow? And then try something small. Orient to the room, feel your feet on the ground, breathe in the lower back ribs, move towards ease first, and then recheck, because it already will change. Restoring flow in the body is not about force, it's about permission and giving the body an experience of safety that's believable enough to let go. And when you understand fascia is not a passive wrapping, but a living communication, you begin to realize that healing isn't just about lengthening tissue or getting to some optimal place. It's about changing the conversation that your whole tissue lives in. So if this helped you understand the body in a new way, take a moment, like the video and subscribe. It keeps me able to do the content. And let me know in the comments what you noticed when you tried that small movement, or what shifted when you started thinking about fascia as a network instead of just this tight, static thing. Because remember, your body isn't failing, it's adapting. And when we work with that intelligence instead of against it, real change becomes possible. So soften before you strive. Safety first, change second. And smile in the corner of your eyes and let it travel right down into the body. And I look forward to seeing you in the very next episode. Thanks.